Welcome to In Your Neighborhood. I'm your host, Charlotte Brown, and on today's show we are talking with St. Joseph's Care Group. My guest today is Andrew Koschelniak. He is a kinesiologist over at the Chronic Pain Management Program. So welcome to the show, Andrew.
Thank you very much for having me.
So let's talk first a little bit about what chronic pain is.
Chronic pain is persistent pain lasting longer than 3 to 6 months that hasn't really responded to any treatments tried. And this pain may be greatly impacting a person's quality of life.
So let's give maybe some examples of that. So are the people that you see people who've been in accidents or, are living with maybe a disease, have maybe arthritis or something that has chronic pain? Give me some examples.
So really, we see a lot of different people in our programs, and pain may have started for a lot of different reasons as well. So it could be because of an accident. It could be because of surgery. It could be because of many different scenarios. But ultimately, the pain has gone beyond the expected healing time and has continued to persist and again be quite problematic for the individual.
So now it's gotten to a point where it's now interrupting somebody's normal everyday life. So how would someone living with chronic pain describe the impact that chronic pain has on their lives?
So whenever I'm talking to clients or groups of people about chronic pain, I usually refer to a health spectrum. So I think of health in many different aspects. And from my experience, chronic pain may impact all areas of the health spectrum. So socially or spiritually, individuals with chronic pain tend to isolate themselves. Emotionally or mentally, statistics have shown that 50% of people with chronic pain waiting for pain services experience moderate to severe depression. Physical functioning is usually impacted, and because of that, it can lead to other chronic health conditions, and financial well-being can also be impacted as well.
Right, so really you can see impact in all areas of people's lives, that maybe in an accident, a split second, that your entire life has changed. You're maybe having to learn how to redo things all over again, something as simple as walking or eating or getting something out of your cupboard or all that kind of stuff, right?
That's correct, definitely. People come into our program sometimes with what some may consider basic goals. And I don't ever want to downplay an individual's goal, but it's not uncommon that just regaining some level of physical function to be able to participate in normal activities of daily living and normal tasks that people may take for granted daily could be a specific goal that clients come to our program wanting to achieve, wanting to regain some level of function and ultimately improve quality of life.
Right. And in some ways, is there almost a grief process? Like, the thing that you can't do something anymore that you were able to do, or that maybe you can't do it the same way you were able to do that?
Definitely. Really great question. So grief does come up often in our program, and from many different areas. So if an individual is not currently working because of the pain that they're experiencing, they may be grieving the loss of that professional role they once had. If an individual isn't able to function in the home setting, maybe as a caregiver or a partner to a significant other, they may be grieving the loss of those roles. So sometimes people come in and again, when looking at that health spectrum, it may not just be from that physical perspective of I'm not currently able to do this activity because of pain, but also how is it impacting the person as a whole?
Mm-hmm. I'm sure it can even have a huge impact on people's relationships, that you're not the same person, you don't feel like the same person. Maybe you're not, like you said, you're going through depression, you're not the same happy-go-lucky, or you start isolating yourself. I'm sure it can have a huge impact on the relationships around you as well.
It definitely can, and individuals that come into our program and talk to us about their home setting or their support networks outside of the program do talk about how they may not want to even tell people at home or friends how they're doing because it may not be well, and they don't want to burden others with what they're going through. We talked about depression and even anxiety and how chronic pain can impact mental health. And that could put quite a strain on relationships. We think about financial burdens if individuals aren't currently working, and the strain that could potentially put on a relationship. So pain can really impact a person from a lot of different angles. And because of that, we have quite a large interprofessional team that we utilize to really try to overcome pain, or at least teach the client the skills to overcome pain from many different avenues.
Right. So let's talk about if I found myself, living with chronic pain, what are some things that I could do about it?
So if you found yourself living with chronic pain, what I'd recommend is to talk to your primary care provider, so either your nurse practitioner or family doctor, and talk about a referral to the St. Joseph's Care Group Chronic Pain Management Program.
And let's talk about what the program looks like. So I go to my doctor, I talk about kind of what I've been feeling. They suggest that, yes, that's a great idea. We think you should go and check out the program. Am I going to meet with somebody? Is there a consultation to start with? Is there a kind of a checklist to see if you would match the program or not? I'm curious as to kind of the steps.
Yeah, definitely. All great questions. So when people refer to our program, we start off with a welcome session. And this is a session where we bring potential clients into the health center, where we hold our in-house chronic pain management program. And what we do is we basically tell the potential clients everything that they would need to know about our program to make some decisions if it's right for them. Once they come to the welcome session and they do think that, yes, I'd like to participate in this program, then they would come in for a questionnaire session. And these questionnaires are really useful information for clinicians on the team to help us learn a little bit more about the clients coming into the program, and as well help us measure changes from pre and post program. Once the questionnaire session is completed, then clients would come in to complete a clinical determination report with a team decision guide. So the decision guide is really there to help the client navigate the services that we have to offer.
Right. So let's go back to that initial welcome session.
Okay.
So would I meet with somebody like you, or is there somebody else that you'd sit there and have a conversation with just about kind of what's going on, what you're feeling, those kind of things?
So the initial welcome session, or our welcome session, basically we bring clients in into a group setting, and we do a PowerPoint presentation. So it might be myself or another clinician on the team that talks about how pain may be impacting their lives, and also talks about the program that we have to offer. We try to answer any questions that may come up. We really just want to inform clients as much as we possibly can about our program, and help them make the decision, or at least start to think about, is this the right place for me?
Right. And is this program kind of the same for everyone, or I know you said there was a kind of a team of professionals that's on this team. Is it kind of individualized based on the person and their pain and what their issues are that they want to address, or is it kind of different for everyone, or is it kind of the same, or like what does the program look like?
So our chronic pain management program really has two different streams that clients can take, and we introduce this in our welcome session. So we have our 6-week chronic pain management program, which is held at St. Joseph's Health Center, which is on 710 Victoria Avenue. And that is where clients would actually come to the health center for 6 weeks straight. They would come Monday to Thursday from 9 until 1 p.m. And during that time, they would participate in group education sessions, group movement sessions, and relaxation sessions. There would be individual counseling for clients, as well as individual exercise prescription. Although it's a group setting and clients come into and leave the program at the same time, it is very individualized, and it really is based on client goals. So if clients come into the program, and when they meet with that decision guide before they even enter a 6-week program, they would determine some of their top priority SMART goals. And then from there, we would start to develop a care plan that would be unique to each individual entering our program.
Awesome. Well, we're going to take a quick break, but we're going to be right back with Andrew and talk more about St. Joseph's Care Group chronic pain management program.